Hi there. I had a script made up for me, Mr. Wiltshire.
Yeah.
It's for
Last
Viagra.
name? Yeah.
Yeah.
Okay. Oh, here's your script, Mr. Wiltshire. You've already signed everything?
Yeah, it's good for you.
No worries. You're welcome.
Hello.
Hello, how you doing there?
I'm good, thank you. I've got this script. I'd like to get it filled.
Yeah. The script's for yourself?
Yeah.
Yeah. And you don't have any allergies?
No,
You know?
not that I'm aware of.
No? No worries. Shouldn't take that long. Can I have a seat if you like?
Yeah.
No worries. Alright, Mr. Alfred.
Yes.
Yeah. This script's for you.
Thank you.
I'll just get you to sign there for me and just double check that's your name and address. Sometimes
That's wonderful, thank you.
beautiful, thanks. Okay, so you've this medication's for you.
Yeah.
Yeah. And do you take any other medications at the moment?
No, I don't actually. I don't.
Okay, well, so I forgot to introduce myself. I'm Bassam. I'm your pharmacist today.
Yeah.
And
Nice to meet you.
I'm just gonna ask you a couple of questions regarding
Yeah,
this
no
medication
worries.
because I realize you just started this medication and in case you have any interactions with anything or.
Yeah. No worries.
Alright, so you don't take any other medications, you said?
No, I don't. No.
You don't have any health conditions?
Oh, no.
Alright. So, do you know what you're taking these medications for?
Yeah, I've been having some shoulder pain recently.
Oh.
Very severe. Okay.
Yeah.
I used to take Panadol, but I used to take Panadol for a while, but I stopped it because I found it ineffective.
Was that for the shoulder pain as well?
Yeah, but it was ineffective, so
Yeah.
I stopped it. I'm not taking anything at the moment. I went to the doctors and they prescribed me this medication.
Okay.
Apparently they said it's going to be a bit more effective.
Yeah, well it definitely is. Because this one has the Panadol in it, which is the paracetamol, that's the active ingredient,
Yeah.
as well as got the codeine phosphate. So these are the two ingredients in here.
Okay.
This is it's a very powerful painkiller, so it's a lot more effective than the Panadol that you've been taking previously. So this should help with your pain
Okay.
a lot more better.
That's quite good.
And just to run through some symptoms that you might get, or like adverse effects as we call it.
Okay.
You might get some constipation with this medication. It's quite common with people. But the thing is, we always tell people is just try to keep your fluids up, so drink a lot of water, juices, things like that.
Yeah.
Try to take a lot of fiber in your, so things like vegetables, fruits, you know.
Okay. Would I be able to get something similar, but that does not cause the same effects, side effects?
No, that's what the doctors prescribed actually, and this is quite a common use for the type of injury you've got and the pain. So yeah, just make sure you keep fluids up, you know, your fiber, and if the constipation seems to persist with you, then you can just come back. We'll give you some sort of a laxative, you know, and then if that's the case.
Okay.
Also, if you get some of the symptoms like shortness of breath, like if you get some mouth ulcers, things like that, then you should stop the medication immediately. Go see your doctor.
Okay.
Because that is an indication that you're not tolerant to this medication.
Okay.
I highly doubt that will happen because you've used the paracetamol before, you didn't have any problem, you don't seem to have any allergies.
No.
So that should be alright.
Okay.
And the doctor has instructed you for 1 to 2 tablets 4 times a day.
Okay.
So that's, you can take 1 or 2 tablets 4 times a day, and the maximum you can take is 8 tablets a day.
Okay.
So do you understand these
Yes.
instructions?
You said 1 to 2. How am I
Yeah.
supposed?
So because this is like when required, so when needed.
Okay.
So it depends on your pain. So if one day, for example, you've got very severe pain, you can take 2 tablets 4 times a day.
Okay.
And if one day you feel like it's not that bad pain, you just take 1 tablet 4 times a day, whenever you need it. So it's when needed, when necessary.
Okay. And what happens if I have the pain but I forget to take?
Oh, you can. Well, you mean if you miss a dose?
Yeah, I miss a dose. Yeah.
Yeah. Well, in that case, you can just take the next dose whenever whenever you remember to take, because this is a PRN, so you don't have to. As long as you don't make up for the ones that then you will double dose on things.
Okay.
So just make sure you take it whenever you remember,
Okay.
and no more than 8 a day.
Okay.
And make sure you space them out 4 to 6 hours.
Okay.
So don't take it too close to each other, because that will have worse side effects on you. And also with the Panadol, you have to stop taking any other preparations that contain any paracetamol in it.
Okay.
So this is things like your Panadol, your Panamax, even the things like Lemsip and things like that.
Yeah.
They contain Panadol, some of them. So you have to stop taking any other stuff that has Panadol in there, because that will make you double dose on.
Yeah, I'll
the
stop
Panadol
taking
that's on it.
Panadol. So.
Yeah. And you don't take any other complementary medicines,
No,
like
no.
supplements, herbal
No,
things?
nothing like that.
No worries, yeah. So, and I've also printed your CMI in here, which should answer any questions that you might have. You know, it's got all the adverse effects, everything in here.
Yeah.
And if you have any other questions, you can give us a call or come back.
I'm going out for a drink tonight, so that's gonna be.
Oh,
Yeah.
one last thing, sorry, forgot that. This medication is not tolerant for alcohol,
Oh.
so you cannot actually drink with this medication
Okay.
because that will increase your drowsiness.
Oh,
As it
does
can
it cause drowsiness?
It can cause a bit of drowsiness, and so while on this medication, you should try it out maybe at home at the
Okay.
start, and then see how you react to it. If you react badly, then you know you should not drive any cars, operate any dangerous machinery, things
Okay.
like that.
Okay.
But you know, if you seem like you're fine and everything, then you can go back to normal health. But make sure you try that at home first.
Should I take it without food or?
This medication doesn't really matter, but if you feel like you're getting a lot of the nausea, vomiting sort of effects, then
Okay.
it might help to take it with a bit of food,
Okay.
just to settle your stomach a little bit.
Thank you so much.
No worries, you're
Thank
welcome.
you.
Thank you.
Bye-bye.
See ya. Bye.